Okay, let's start recording our session and start in 2 minutes. First of all, I'd like to apologize, you guys. Due to unexpected events, I had to go to my chief physician for an important meeting. So that's why our schedule is delayed by 2 hours. I'm really sorry for that. And for tomorrow's session, I am planning to make it in 3 p.m. But again, it's an important events are happening in our hospital. So I may have to change the schedule for earlier or later. I'll inform you guys. Today I will arrange another Zoom meeting for you. So before your finals, we are going to repeat all of these classes that we learned together. So I'm going to emphasize on the important parts. So I want you to listen to me carefully. Uh, and also, I'm recording this session and I'm going to send you guys the link or the video so you can repeat again. Our final exam will take in this Wednesday and Wednesday evening. So, first of all, I wish all of you guys a very successful final exam period. Uh, it's not important. Just trust yourselves and work hard and just try to memorize the things I am emphasizing on. Work hard, work smart, not hard. So let's start with our session with head and neck anatomy. Now, we talked about the blood vessels, we talked about arteries and venous system. Uh, the basic design of human anatomy is there's an artery, there's a vein, there's a nerve, and there's a lymphatic system. It happens all within our body. So, yes, there were big arteries, important arteries goes through in our neck. One is common carotid artery, and that common carotid artery give two branches. One is external carotid artery, the other one is internal carotid artery. What was the important part, important information, important feature of internal carotid artery? It never gives any branches while it goes through in our head and neck region. Of course, it is going to give some branches within our skull or skull base. That's not what I'm talking about. I am talking about the neck. And the neck region, internal carotid artery, never gives any branches. I'm not expecting you to memorize this. Just know that no branches. Let's take this. No branches in neck, and then it enters the cranial cavity. It gives branches afterwards, but through its course in neck region to skull base, no branches at all. It's an important information. Again, I'm not expecting you to memorize all of these things. I'm just expecting you to know that internal carotid artery never gives any branches in head and neck region. Veins, they have many multiple classifications, but they also have many malformations. You don't need to memorize these. Then, the important nerves, my dear nerves, cranial nerves. I'm expecting you to know their name, know their basic function, and know their number. They are named in numbers. First one is olfactory nerve. It's for smelling. The second one is the optic nerve. It is for seeing. Oculomotor nerve is the third one. Trochlear nerve is the fourth one. And abducent nerve is the sixth one. 3, 4, and 6. Those three are responsible for eye movements. Trigeminal nerve, it is a very big nerve and it is responsible for touch and sensation feeling of our face. Facial nerve is responsible for facial mimic muscles control. It's the seventh cranial nerve. It is my favorite nerve. Vestibulocochlear nerve, it is for your balance and for hearing. Glossopharyngeal nerve is the ninth nerve and it is for swallowing. Vagus nerve is the longest cranial nerve. It is very important parasympathetic nerve and it starts from your skull base, goes through your entire body. Accessory nerve is the 11th cranial nerve and it is supplying the sternocleidomastoid muscle and trapezius muscle, and hypoglossal nerve is the nerve that supplies the extrinsic muscles of your tongue. These are the basic functions of these nerves, and I want you to know their basic functions. I want you to know their numbers, and I want you to know their names. Again, cranial nerves, they come in 12 pairs. Forget about the spinal nerves. I'm not going to ask about the spinal nerves, but I am going to ask about the cranial nerves. This is also important. Now, there are many muscle groups in our head and neck region. Muscles for facial expression, mastication, tongue muscles, extraocular muscles. They're tiny muscles in our ear. They're big muscles. They're muscles in our soft palate and our pharynx. I'm not going to give details of these. Now, the paranasal sinuses, it's you must have remembered them from our first term. They are four paired paranasal sinuses. They are located in our frontal bone, in our maxillary bone, and ethmoid bone, and our sphenoidal bone. Just know that there are four paired paranasal sinuses: sphenoidal, ethmoidal, maxillary, and frontal. They're air-filled cavities and it resonates your voice. It lightens your skull and it humidifies the air. And these are the basic functions of the paranasal sinuses. And know there are four paired sinuses in frontal bone, maxillary bone, ethmoid bone, and sphenoidal bone. Again, frontal, ethmoid, maxillary, and sphenoid sinuses. What did we talk about? Neck region. There's one important muscle. There's one key muscle that's just important for me to localize things, and it was the sternocleidomastoid muscle. It is going to divide my neck into two main triangles. The first one is located in the anterior border. It's called anterior triangle. The other one is called posterior triangle. And between them, this is the key muscle. This is the sternocleidomastoid muscle. It is going to divide my neck into two major Triangles, it's important. Sternocleidomastoid muscle is the key muscle for my head and neck region. Again, we talked about triangles. Uh, ima Imagine, and there's an imaginary line that just caught me in my middle line. It's called midline, right here. And sternocleidomastoid muscle divides my neck region into anterior and posterior triangles. These triangles then subsectioned as a submandibular triangle, submental triangle, carotid triangle, muscular triangle, and posterior triangle. I don't want you to memorize these, but I want you to know that the sternocleidomastoid muscle is the key muscle for my neck, and it divides my neck into two main triangles. This guy is important for me. Again, the there is you guys remember, there is a hyoid bone that located in the midline of my neck. It has no connection with any other bones whatsoever. It is just hanged in the air by muscles and ligaments. And there are four suprahyoid and four infrahyoid muscle. And I want you to guys know that which one is supra, which one is infra. Supra means up, infra means low. So the suprahyoid muscle is digastric muscle. This is the two-bellied muscle. Mylohyoid muscle is for the floor of mouth. Geniohyoid muscle is also for floor of mouth. And stylohyoid muscle, it just for, it's a helping muscle for swallowing. And infrahyoid muscles are omohyoid, sternohyoid, sternothyroid, and thyrohyoid. Try to imagine the structures lined from top to below. On top of that, we have our hyoid. Under that, we have our thyroid cartilage. Under that, we have our cricoid cartilage. So if you think sternohyoid, sterno means sternum. You guys know where sternum is located. Sternohyoid muscle starts from sternum, ends in hyoid. Sternothyroid muscle starts from sternum, ends in thyroid cartilage. Thyrohyoid muscle starts from thyroid cartilage, ends in hyoid bone. And omohyoid is the only infrahyoid muscle you need to memorize. Okay? These are self-explanatory. This one, yes, you may get confused, but it's just another muscle, only one name you memorize, and there you go. You learned the name of infrahyoid muscle. And if you know the infrahyoid ones, you can easily guess the suprahyoid ones. Which one is not an infrahyoid muscle? A, omohyoid, B, sternothyroid, C, sternohyoid, D, thyrohyoid, and E, digastric muscle. If I know the name of these four guys, I can easily guess which one is the suprahyoid. The same one can be applied for suprahyoid muscles. Which one is A, suprahyoid muscle? A, digastric, B, mylohyoid, C, sternohyoid, D, genohyoid, and E, stylohyoid. I know that sternum is located below, and the structure between sternum and hyoid is highly unlikely an infrahyoid muscle. So that's what I'm saying. I'm trying to mean work smart, not hard. Just know these guys' name. You know their alignment, hyoid, thyroid, cricoid, and sternum. You know they're going from up to down, so you can easily guess the infrahyoid muscles. Only know the name omohyoid. It's kind of different. We are going to talk about larynx more detailedly. So these are another structures that located in our head and neck region: larynx, thyroid, and parathyroid glands. Also, our salivary glands are located in our head and neck region, such as our parotids, such as our submandibular, sublingual, and minor salivary glands. I'm not expecting you to memorize lymph nodes of the head and neck region. These are for oncologic surgeons only. You don't need to memorize them. We don't have to memorize the tooth anatomy. This was our first slide. Now, let's continue with our laryngeal muscles. Now, there are two types of muscles in our larynx. One is extrinsic, the other one is intrinsic. Intrinsic muscle means they're tiny little muscles that you cannot identify with your eye. If you dissect a patient's neck, you are going to see this infrahyoid or suprahyoid muscles. These are extrinsic muscles. They are enveloping the organ from outside. It just makes major movements, but intrinsic muscles are tricky. They are doing the tiny little work. Extrinsic muscles, they attach larynx in your neck. They are responsible of your larynx whole laryngeal movement going up and down while deglutition. All extrinsic muscles and all intrinsic muscles are paired, but the movement of these extrinsic muscles are moving your larynx whole. But intrinsic muscles are the tricky ones. Intrinsic muscles attach in your laryngeal cartilages, and they are responsible for tiny movements. They open your vocal cords or close your vocal cords. They increase the tension of your vocal cords or decrease the tension of your vocal cords. While we're talking, while we're making noises, we are using our vocal cords, but the only thing about our larynx is not just opening and closing our vocal cords. We are tightening them, we are loosening them, we are changing our tone, we are changing our pitch. I can talk loud, I can talk low, and these all things happening in our vocal cords, and they are made by our intrinsic laryngeal muscles. The intrinsic muscles are also grouped. Many of them are closing the inlet of larynx. Thyroepiglotticus muscle opens the inlet of larynx. Many of them adduct the vocal cords. Only posterior cricoarytenoid muscle abducts the cords. Let's put a little tiny star here. Your cricothyroid vocalis muscle are tensing your vocal cords, but thyroarytenoid muscle are relaxing your vocal cords. No need to memorize these things, just pay attention to a couple of things. Cricothyroid muscle is the only muscle lies on the external surface of the larynx, but also an intrinsic muscle. This is a fan shape cricothyroid muscle. What is the important part? What is the most important feature of this muscle? It is supplied by the external laryngeal nerve. The other intrinsic muscles are going to be supplied by your internal laryngeal nerve or your recurrent laryngeal nerve. This one is an exception, and exceptions are possible questions. Posterior cricoarytenoid muscle is the only one that abducts your vocal cords, which is important. Again, this is important information. All of the intrinsic muscles of your larynx are supplied by your recurrent laryngeal nerve, except cricothyroid muscle. Cricothyroid muscle is the only intrinsic laryngeal muscle that's supplied by external laryngeal nerve. Exceptions are possible questions. Know that posterior cricoarytenoid, know about this because it abducts the vocal cords. Most of the intrinsic muscles are designed to work to close the laryngeal inlet. Laryngeal inlet means the space between your vocal cords. It is very important inlet because it is the narrowest part of your larynx. If it closes, you die. There's no need, no further questions. This posterior cricoarytenoid muscle is an important muscle because it abducts your vocal cords. The others are closing the inlet, but posterior cricoarytenoid muscle is just abducts your vocal cord. And also another exception is your cricothyroid muscle, which is supplied by external laryngeal nerve. Every single intrinsic muscle is supplied by recurrent laryngeal nerve, except cricothyroid muscle, and exceptions are possible questions. Now, the muscles of neck and trunk. We talked about the muscles of the neck. We talked about the important ones. We talked about which one is infrahyoid, which one is suprahyoid, which main muscle is important for us, which is our sternocleidomastoid muscle. This muscle is important because it is going to divide my neck into two major triangles, the anterior triangle and the posterior triangle. This muscle, sternocleidomastoid muscle, it is important. Again, infrahyoid muscles are omohyoid, sternohyoid, sternothyroid, and thyrohyoid. Just know these four, and you can interpret the other ones. You can guess the other ones. The suprahyoid muscles are summarized here. Let's come to the lateral muscles of the neck, splenitus capitis and platysma. Platysma is also another facial expression muscle which is under control of your seventh cranial nerve, facial nerve. I don't need you to memorize these things. Muscles of the trunk. Again, just know the supra and infrahyoid muscles, infrahyoid muscle and suprahyoid muscles, and also know that this is the main divider of my neck region, the sternocleidomastoid mastoid muscle. I don't want you to memorize any other things, just know this guy and know the suprahyoid muscles and infrahyoid muscles. Now let's come to the muscles of trunk. There are many tiny muscles that supports your back, and I'm not expecting you to memorize every single of these muscles, but they're collectively, know that they're collectively control your vertebral column. There are many muscles aligned on both of your sides of your vertebra. Just know that they are supporting your vertebral column. As you can see, there are many muscles. But what is their main function? If you delve into details, yes, they all have different functions because they're different muscle groups. But what is the common part? Extend the vertebral column, extend the vertebral column, extend the vertebral column, extend the vertebral column. Extend, extend, extend the vertebral column. So it is not wrong to say that basically my trunk muscles are supporting my vertebral column and extends it. Deep muscles of thorax. Yes, in our thoracal region, we have our diaphragm and we have our external, internal, intercostal muscles, subcostal muscles, and transversus thoracis muscles. Diaphragm is important because it is dividing your abdominal cavity from your thoracal cavity. On top of that, your lungs are sitting on, your heart is sitting on, and these two cavities are separated by your diaphragm. It's a very important, very big muscle. It has a central tendon. If you may remember, the central tendon was just inserted by many big vessels and organs. But know that the diaphragm is the one that separates your abdominal cavity from your thoracal cavity. This is the diaphragm. As you can see, this is the diaphragm. Diaphragm extends in your thoracal cavity and it separates your thorax from your abdomen. This is the cross section of your diaphragm. On top of that, we have our heart, we have our lungs, our esophagus, our inferior vena cava, our aorta has a very close connection with our diaphragm, which is a very important structure. But just know that there is a big, giant muscle that separates your thoracal cavity from your abdominal cavity. And muscles of the abdominal wall. We have many abdominal wall muscles: external oblique, internal oblique, transverse oblique, transverse abdominis, rectus abdominis, quadratus lumborum. Again, I'm not going to delve deep into the every single function, but one thing is important. Compresses the abdominopelvic cavity, compresses the abdominopelvic cavity, compresses the abdominopelvic cavity. So it's not wrong to say that abdominal trunk muscles are compressing. Their main function is compressing the abdominal pelvic cavity. It is not wrong to say. And the floor of your pelvis, your abdominal pelvic cavity, this is something called pelvic diaphragm. And pelvic diaphragm is made by two muscles. Know their names, levator ani and coccygeus muscles. They are supporting your pelvic floor, which is very important for every single person. But know that there is something called a pelvic diaphragm. Know it has two parts. One is called levator ani, one is called coccygeus. Levator ani is made by two muscles, iliococcygeus and pubococcygeus muscles. And our pelvic diaphragm is made by levator ani muscle and coccygeus muscle. How can I memorize these? They have coccygeus in their names. So they are two main muscles in my pelvic diaphragm, levator ani and coccygeus muscle, and that levator ani has two parts, iliococcygeus and pubococcygeus. Know these names: coccygeus, coccygeus, and coccygeus. Muscles that act on scapula. Scapula is another part of your shoulder girdle, if you remember. There are many muscles that attaches your scapula. Scapula is very important for your arm movements because your humerus is making a joint with your scapula, and there are many muscles that attaches to your scapula. Each one has different functions. I'm not asking you to memorize any of these things. Muscles that act of your arm, they're doing flexion, extension, abduction, medial rotation, and lateral rotation. Again, I'm not expecting you to memorize these things. I'm not going to ask about these things. Now, pectoral region. In our pectoral region, what is the main function? It is supporting your upper extremity. In our pectoral region, we have our breasts, we have our pectoralis major muscle, pectoralis minor muscle, serratus anterior muscle, subclavius muscle, and neurovascular bundles. We've talked about breasts. They are specialized accessory glands. Their function in females to produce milk, and they're used for sexual arousal. They can be found anywhere from inguinal region to axilla. They present in both sexes. What kind of color is this? Let's go with pink. Sorry. Guys, they are present in both sexes, okay? Don't confuse it. They are present in both sexes and normally two in numbers. It's not only important for females, they are present in males too. Yes, the male breast is like pre-pubertal female breasts, but when a female goes through a puberty, our breast starts to change. They are very prone to hormonal sensory, so they change throughout the hormonal course. They are changed under puberty, they change under pregnancy, they change under lactation, they change under postmenopausal part, they are very highly sensitive to hormones. It's not wrong to say that. Just know that they are present in both sexes, okay? You have four muscles in pectoral regions. If there's something comes in four, the fifth one going to be the answer to the question. So if I ask about the muscles of pectoral region, which one is not a muscle from pectoral region? And I'm going to say pectoralis major, minor, subclavius, and serratus anterior. And the fifth one is going to be the answer. So know the muscles of the pectoral region. I'm not expecting you to know their origin, insertion, nerve supply, or action. I just want you to know their names. That's all for the pectoral region. I'm not expecting you to memorize every single thing. I'm just asking you to memorize the things I'm telling you to memorize. Okay? And now this is the last slides. The rest of them, your pelvic region, your gluteal region, your thighs, your legs and foot, I'm going to talk about them tomorrow. The anatomy of arm, forearm, wrist, and hand. Muscles of the upper arm. This part is going to be called arm. This part is going to be called forearm from now on. Now, our upper arm is located between our shoulder and our elbow joint. It contains four muscles, three in the anterior compartment and one in the posterior compartment. From now on, we are going to investigate our extremities in compartments. And for our arm, I have two compartments, anterior and posterior compartment. I have biceps brachii, brachialis, and coracobrachialis muscle in the anterior compartment. Biceps is not the most powerful flexor of the forearm. Coracobrachialis muscle, it is also responsible for arms flexion. But know this. Brachialis muscle is the strong flexor, the strongest flexor of your forearm. Okay? Know that the brachialis muscle is the strongest flexor of your forearm. And the posterior compartment, I have one muscle with three heads. Triceps's primary function is extension of your elbow joint, okay? Just know that triceps is responsible for elbow joints extension. Let's come to the muscles of forearm. The forearm, let's remember we have two bones in our forearm. One bone in my arm, it's called humerus. Two bones in my forearm, it's called radius and ulna. Radius located on the lateral side, ulna is located on the medial side. They are typical long bones. They make connection with your humerus and your wrist bones. There are two groups of forearm. We are going to compartmentalize our forearm like our arm. It's the anterior and the posterior compartment. And I keep compartmentalize my anterior compartment of my forearm. Superficial, intermediate, and deep compartment. Now, At the superficial layer, four muscles: flexor carpi ulnaris, palmaris longus, flexor carpi radius, and pronator teres. Know the names of these muscles that is located at the superficial layer of the anterior compartment. Guys, turn off your mics, please. And intermediate layer, we have one muscle, and it's called flexor digitorum superficialis. And in the deep layer is flexor pollicis longus, flexor digitorum longus, and pronator quadratus. The anterior compartment of your forearm is the flexor compartment. Posterior compartment is divided into superficial and deep layer. This part is anterior compartment is flexor, so the posterior compartment is going to be the extensor. On the superficial layer, external carpi, extensor digitorum, extensor carpi ulnaris, extensor digiter minimi. The superficial layer of the posterior compartment have extensors. And the deep layer, we are having our pronating and supinating muscles. I'm not going to ask about the anatomy of hand or wrist, but then again, there are 27 bones located in our hands. It's called phalanges, metacarpals, and carpal bones. Again, the proximal and distal row of the carpal bones are important. In the proximal row, we have scaphoid, lunate, triquetral, and pisiforme, and distal row, trapezium, trapezoid, capitate, and hamat. I'm not going to ask any further questions about your hand or your wrist. Just know the rows. That's it. You don't need to know the muscles of the hand or the sensation of the hand. These are not important. No need to learn about the veins or nerves because you don't need to memorize this list. So, for our arm and forearm, I just want you to memorize the anterior and posterior compartment and the muscles located there. For its 67 slides long presentation, and I want you to know only a couple of them. All right? The anterior compartment, the muscles located there, the function of brachialis muscle, triceps function, the only muscle that located in the posterior compartment, and muscles of the forearm. Yes, this is not a easy subject, I know, but it's the only thing I want you to know. All right? Let's work smart, right? Let's first memorize that our anterior compartment of my forearm is the flexor compartment. Posterior compartment of my forearm is the extensor compartment. It is going to make things so much easier for me to memorize. If a muscle name starts with flexor, it is probably belong to the anterior compartment. If a muscle's name starts with extensor, It is probably belong to the posterior compartment of your forearm. We are going to divide them into more sections: superficial, intermediate, and deep. Superficial layer has four muscles. Just know their names: flexor carpi ulnaris, palmaris longus, flexor carpi radialis, and pronator teres. We have only one muscle in our intermediate layer and the flexor digitorum superficialis. And at the deep compartment, we have our flexor digitorum profundus, flexor pollicis longus, and pronator quadratus. Then again, anterior compartment is the flexor compartment. If a muscle name starts with extensor, it doesn't belong in the anterior compartment. I just want you to focus while you're taking your test, okay? The posterior compartment is the extensor compartment. It is going to have two layers, superficial and deep layer. At the superficial layer, I have extensor carpi radialis brevis, extensor digitorum, extensor carpi ulnaris, extensor digiti minimi. This is the extensor compartment of my forearm. I just want you to know the fact that the anterior compartment is the flexor compartment and the posterior compartment is the extensor compartment. It applies both for your arm and for your forearm. The anterior compartment of your arm is also the flexor compartment, and posterior compartment of your arm is the extensor compartment. Just for upper extremity, try to memorize it. It's going to make everything so much easier. Again, I'm saying if a forearm muscle's name contains extensor in it, it belongs to the posterior compartment. It has no job in the anterior compartment because anterior compartment is the flexor compartment. Just know this tricks, okay? I'm not expecting so much. Just know this couple of little tricks, okay? For tomorrow, I am thinking 3 p.m. But we are organizing a World Congress in Turkey for our ENT community. So we are kind of busy. I can be called into emergency meetings for this Congress for organizing things. So I am planning to make our session in 3 p.m. But if something goes wrong, I will just inform you before or after. I will finish the rest of our slides. We're going to repeat gluteal and pelvic region, our thigh muscles, our leg muscles, and our foot muscles. I'm not going to ask anything about foot or hand or wrist. I'm just going to ask about the big groups and the things I'm emphasized on. Cranial nerves, I want you to memorize them. There are 12 pair and you need to know their function, their basic function, their number, and their real names. I just want you to know their names, their functions, and their numbers because it is going to be asked. It's a definite possible question. For laryngeal muscles, please note the exceptions. What is cricothyroid muscle is supported my external laryngeal muscle. This, from all you have to know this and this. There's two slides. Only these two slides, okay? For pectoral region, know the information about breasts. They're hormone sensitive organs, but they also present in both sexes, in females and males, okay? Just know this. Know the names of the muscles that located in our pectoral region. Pectoralis major, minor, subclavius, and serratus anterior. There are four muscles. The fifth one is the possible answer. And I explained for the anatomy of arm and forearm. Know that there's something called anterior compartment, something called posterior compartment. For our arm and forearm, the anterior compartment is the flexor compartment and posterior compartment is the extensor compartment. Especially, it's really good trick for my forearm muscles. Okay? Just know the compartments and the muscles that lies within, and also know that the brachialis muscle is the strongest flexor of forearm. Okay? While I'm talking about the strongest flexor, I'm talking about the strongest flexor of my forearm, not my arm. All right? Again, you don't have to study for your wrist and hand region. Just take a look at the proximal and distal row of the carpal bones. No any additional things, okay? And muscles of the trunk, let's find it. Neck and trunk. The major divider of neck region is the sternocleidomastoid muscle. There is a special bone located in there, hyoid bone. Why is it special? Because it has no attachment with any other bones. It is hanged in the air by muscles. So you know the order: hyoid, thyroid, cricoid, and sternum. So you can easily memorize the infrahyoid and suprahyoid muscles. Infrahyoid muscles, you only have to memorize the omohyoid. The others' names are self-explanatory. So from that, you can guess the supra and infrahyoid muscles. Please pay attention to this. The muscle groups that located in our trunk, that located in our abdominal region, abdominal wall, in our pelvic region. For muscles of the trunk, you just have to know their main function, their collective function. What are they doing? They're extending our vertebral column. That's all we have to know. What my muscles of the abdominal walls are doing, their main function altogether, they're compressing our abdominal pelvic cavity, flexing my vertebral column. I'm not asking about the details. I am going to ask the main function. What is the main function of the abdominal wall muscles? It is compressing abdominal pelvic cavity. These are the few key points that you need to pay attention while working on your exam. Don't get so hard on yourself. Just study on the things I give tricks about, I give key points about. The final exam is easier than you think, but if you work in a focused way, okay? If you dive deep, uh, you can get lost. And we don't need that kind of an anatomy. Just know the basics. Just know the main structure. Just know the big parts. Just compartmentalize the big parts. It is enough for you guys. You don't need to memorize everything again and again. There are a couple of tricks which I am trying to give you. Just work on them, okay? I don't need you to memorize every single function. Just work on these things. Tomorrow, we're going to finish the muscle groups. This fall term is kind of the most boring part of the anatomy. For our next term, in spring term, we are going to talk about the organ systems. It's more fun. It's more easy to understand. So this is kind of the hardest part of the anatomy section. For our next term, you guys are going to do so much better. You guys are going to find it a lot easier. If you have any questions for me, I can answer it for you. The exam format is test. Uh, you have 25 questions and each questions have only one correct answer and you are going to choose that correct answer from the 5 selections. I'm not going to ask about the general anatomy of joints or ultrastructure of skeletal muscle. Yes, it's going to be multiple choice. Uh, you are only responsible for muscles. Okay? Know the cranial nerves, guys. Their names, their functions, their numbers. Know the details that I told you about this. And if you just work on the things I telling you about, you are going to do just fine in your finals. No joints. I'm not going to ask about joints. Just head and neck muscles, trunk muscles, arm muscles, abdominal wall muscles. I'm going to ask about these things. No further question. The ultrastructure of muscle is kind of a part of your physiology class, so I'm not going to ask any questions about them. It's gonna be tests, it's gonna be multiple choice, it's going to be only from the slides that I talked about from today and tomorrow. Any other questions? So I recorded today's session and I am going to send you guys the video or the link when I go home. I'm still at the hospital right now. Work efficiently. Don't work so hard on yourself. Just work efficiently for each finals. I wish you guys a high success. And I will see you in next Wednesday. I will try to be present at your final exam. So any other questions other than content of the exam or format? I'll wait 3 more minutes and then I'm out. If you want to ask questions, I'm waiting. Any other questions? Yeah, Azra. You can write it down or you can ask. Let's check. I think it's 7 p.m., but let me check again. Don't you guys have the schedule? Your exam will be on Wednesday, January 7th, and will be held in 6 p.m. No, you're not only responsible for the 5 lectures. Tomorrow, I am going to talk to you guys about your pelvic girdle, your pelvic muscles, also your thigh muscles, your leg muscles, your foot muscles. But let's be honest, I'm not going to ask any questions about foot. But you're going to be responsible for neck, your arm, pectoral region, trunk muscles, abdominal muscles, and lower extremities. We talked about the first 5 today, the other 5 tomorrow. We're going to talk about the other 5 tomorrow. So next Wednesday at 6 p.m., your final exam will take place for both nursing and nutrition students. You guys have any other questions? Okay, if you don't have any further questions, I am going to send you guys a meeting link for tomorrow. Again, I am planning for 3 p.m., but like today, I may get called for an emergency meeting, so I will update you. I'll keep you guys updated. And for today's recording, I am going to send you guys the link so you can repeat the class again. Thank you for your time. Again, sorry for the delay for today. See you on next Wednesday. Also, see you tomorrow. Bye.